Hello, everyone, and welcome back to another session of the Civil Debates with me, Vishesh, and Sugandha. Today's topic for the day is: should there be another national lockdown in India, given the surge in COVID cases? And joining me today for this discussion is Sugandha Bandyopadhyay. Welcome back, Sugandha.
Hi, Vishesh. Thank you for having me.
And I'm looking forward to a great, discussion with you today on this.
Me too. Me too.
Cool. So let's clarify for our audience, right? What positions we are taking for this particular, topic. Uh, Basically, I am not in favor of the lockdown, and I think you're saying that there should be a lockdown per se to stop the COVID cases. So maybe you can start away, explain your position briefly of why you think there should be a national lockdown in India.
Steve Vishesh, what I want to first start with is that this topic does not have any concrete right or wrong in it. That's the first thing that we need to understand before we step into this topic. A lockdown, even last year, was a very sudden thing. It came as a blow, and yeah, it imploded. But right now, we are seeing an explosion of cases, and I use the word explosion uh, in a very underrated manner, considering that we have 3 lakh to 4 lakh cases per day, and the death rates have also increased. So, like, I know, like, even if you say against the lockdown, you will have very strong points as to why there shouldn't be a lockdown. We saw the disaster it was last year. But now, what the disaster that we are kind of witnessing every day on the newspaper, on the news channels, everywhere, like even our family members, like I think I speak for almost everybody out here, like we know someone or the other who has gone through COVID. It's rampant. It's like an everyday name right now, and it's scary. So if this is the state of us being in the house, I just cannot imagine what is happening in the hospitals. So let's start from there. Why I am in favor of a lockdown. It is a sudden thing, and it is not a solution. It's just a pause. That's what I want to clarify first. This is not a grand panacea. A lockdown won't be a panacea. A panacea would probably be when 70% of the population is vaccinated. But a lockdown is a pause. And on that note, right now, I was going through like some of the numbers, and they are scary. More than 800 doctors have passed away. 80 doctors have tested positive in Delhi's Saroj Hospital. And Goa is facing a crisis to the extent that there are no place for the bodies to be burnt in the crematorium. I was horrified by a video a few days ago where a Punjabi man was carrying his 11-year-old daughter's corpse on his back because there is no place for her to be burnt. So there is no, so there was this quote in BBC that I came across which really hit me, like there is no respect in life and there is no respect in death here in India. So the government management combined with the healthcare, which is beyond doubt collapsing. We are having final year medical students being deployed in the front line, and I use the word deployed because this is a war. This is a war for good health. And these young boys and girls, they are what? They're probably in their 23, 24. They are being deployed into the front lines to serve, and they are doing somewhere around 14-hour, 15-hour, 16-hour shifts a day. They have no rest, and the pictures are everywhere. They're collapsing. The hospital structures are collapsing. Hospital staff are getting COVID positive. There is no management whatsoever. Even PPE kits aren't present in most hospitals. In UP, in some state hospitals around the country, doctors are not even given proper PPE kits. So just by looking at them, I can say, like, if we just give them, like, 3 to 4 weeks of lockdown, if we can just stop the surge for them, maybe they can help us recover, or whoever is there in the hospital. That is my last case scenario effort which I can think about, which is why I support that there should be a lockdown for a time.
Okay. I totally understand, what you're trying to say. And yes, we have a mismanagement scenario in our country right now, and it's a big episode that is happening, and everything that you mentioned is true in terms of no crematoriums and non-availability of PPE kits, oxygen cylinders, and everything. Basically, it's a whole mismanagement. And maybe I agree with you partly that implementing, let's say, a 3 to 4 week lockdown might stop all of this for a certain time being. Like, of course, it will not stop people from immediately getting COVID. There is still going to be, a human-to-human transmission. It will probably, as you said, slow down the surge for a certain period of time. Right. But you raised a very important point in between, and which is that you said that this is going to ultimately be completely solved when about 70% of the population gets vaccinated. Right. Now, I was just doing the numbers on this, and to understand this, we have to, let's say, compare it with a country like America, where we are in a very, very different scenario. Okay, so even a country like America, with all the healthcare infrastructure and all the logistical infrastructure, at maximum they are able to do only about 10 lakh vaccinations a day. Okay, and if you compare a country like UK, they are at maximum able to do 3 to 4 lakh vaccinations a day. Comparing that with India, even with all the lesser infrastructure that we have, in terms of everything, in terms of cold storage, in terms of movement of the vaccines for the right vehicles for moving the vaccines, in terms of just availability of the vaccines, we are still able to vaccinate about 10 lakh people a day, which is almost the same as what America is doing. But because of India's huge population, where we have up till now given the first dose to about 14 crore people, which is almost the same as what America has done, but ours is 10 times the population. So with our 140 crore population, if we just take the current numbers, which is about 10 lakh doses a day, we will take almost 3.5 to 4 years to actually populate the whole country, and maybe about 3 years to actually vaccinate 70% of the country, versus a country like America, which has already done vaccinated of about 50% of the country, because obviously they have a much
lesser population
to deal with. So considering that scenario, now do you feel that till when are you going to continue this lockdown? Even if you do it for like a 4-week period, we know that a third wave is coming. Okay, compare it with countries like Brazil, with just UK, and with pretty much every other country which has had a third wave, and a third wave, and then potentially now a fourth wave with the current COVID variant, which is the B.1.1.612 or something on those lines, being now it's spreading off to other countries as well. So there's completely a possibility of a fourth wave. So when you have these successive waves coming in one after the other, what is a lockdown even for a 4-week period going to do? Even if it stops the surge and you restart economic activity post that, you're still going to have a third wave, and then you're still going to have a fourth wave. I don't think it's a permanent solution, and you agree with me, I think, on that. But I don't even think that it's a temporary solution, because the moment you restart the activity, these waves are going to come one after the other anyways. So what do you think about that?
Vishesh, for first, I'm going to take one thing at a time. So, the thing that you just mentioned, the variant, the COVID variant. So, since that is there, that is proof that herd immunity will be very hard to achieve. Any virus which is there, you, if it continuously mutates, if person A has this kind of variant and person B has this kind of variant, because of the existence of so many variants and it is multiplying and mutating so fast that herd immunity almost sounds like a fairy tale at the moment. It is not going to happen that easily, because how many mutants can you be immune to? There is always going to be a next one. So people rushing, people mixing and hoping that herd immunity, as it was said last year, would have been a probable solution and a probable, refute against a lockdown. Now that is more or less not there because we have so many variants. ICMR just keeps telling new variants one after the other every day almost. And next thing is that I know, definitely not a permanent solution. And of course, there is a chance of a third wave and then a potential fourth wave. The thing is, I want to give the time for the healthcare to actually, arm up against a third wave. At least a little bit of backup time for them. Right now, the healthcare has not just COVID. They also have this rising cases of mucormycosis. This black fungus disease is rising in post-COVID patients a lot. And every day the numbers keep on increasing. So right now with second wave, that is being worsened by this black fungus disorder. So the beds are not going empty and the doctors are not getting any kind of breaks. More people are coming and there have been video evidence and I would call this evidence because in a COVID world in Uttar Pradesh, people are lying on the ground. That is not how you treat your countrymen or your patients. But doctors, they are compelled to do this. They are not wearing anything. They are not wearing any PPE kits, no mask, nothing at all. And people are just lying and people and their family members are entering. Can you understand? There is a COVID patient, 6 or 7 family members are inside that COVID ward. At least 3 or 4 of them is going to get communicated with the virus. Then they are going to take it outside, and then they are going to afflict more people. And this is an inevitability. The problem right now, Vishesh, is that even if we boost our infrastructure, even if we don't push a lockdown, we can progress in what I say an arithmetic progression. But the virus multiplies and spreads in a geometric progression. We will never be able to reach that. We will never be able to outrun the virus. What we can is basically slow down so that, there is an answer to medication. And this will also give us the time to have an absolute plan for once for the third wave. For the second wave, in October last year, the news came that there is a possibility of a second wave. It is undoubtedly a fact that the government ignored it. And not just the central government, the state governments also ignored it. And there was the Mahakumbh, there were election campaigns everywhere. Nobody was wearing a mask. And we could see the videos, right? Either masks were in the chin or on the ears, but it was not covering and there was no social distancing whatsoever. So we had 6 months. We had 6 months of preparation. We did not use it. And today, this is the case that we have today. For me, the lockdown is a hope that this might be a preparatory period for the third wave. Use this lockdown scrupulously by all the medical professionals, by the government, and even the Supreme Court has said that there will be a national task force, right? For the oxygen crisis, to solve the oxygen crisis. So this is the time for all the governments to arm up, and the lockdown will give them that recess so that there is not a surge of cases that they are having to deal with, but at the same time they can prepare themselves for the third wave. These are the problems that we are going to face: oxygen shortage, PPE kit shortage, medical shortage. So we need to equitably distribute them. I just want that pause to be given to them in the hope that this is going to make things better. Like right now, all like even West Bengal, where I'm from, we are having a lockdown right now. Kerala has a lockdown. Then I think Telangana is also imposing one. In Karnataka, there is also a lockdown. So, but I don't know how effective these state lockdowns individually are being. That is why I was thinking of a national lockdown.
I think you have raised some very important points, so I'll cover them one by one, right? The first thing that you talked about was alternatives. So one alternative that you talked about was herd immunity at the start, and you said that obviously that is not achievable due to mutants, and that's something I feel that is something obviously that is a utopian kind of thinking. I don't agree that herd immunity can be achieved anytime soon. But let's talk a little bit about the alternatives to a lockdown. What might be the alternatives, right? So I feel the one major thing that we can do is mask up the whole of India very, very fast, right? I'm not even talking in terms of vaccine. I'm just leaving vaccination aside. Just mask up India. Like right now, even I can see when I go out and I go out on the streets, there are still people who are not caring about wearing masks. And as you mentioned, election rallies happened, and Kumbh Mela, and nobody was wearing a mask. So I think that message from the center about being very strict about wearing a mask has not very effectively reached the whole of India. Okay, and when you talk about the whole preparation thing, about PPE kits, about oxygen cylinders, etc., and just these these healthcare facilities not being available, and the lockdown as a potential as a potential preparation source for preparation time for this healthcare infrastructure. I don't think that in 4 weeks or 8 weeks we're going to ramp up any of these facilities. I mean, we had a lot of time, as you said, to do it from October to mid-February, but we didn't. And I don't think that an 8-week period or 12-week period would really help in that in any ways. But even if you assume that to some extent it gives a break for the doctors, etc., I still feel that the best alternative solution is to really enforce everybody to wear a mask, maybe double masking if required. And I think that is a much cheaper solution, even in comparison to the vaccine, and a much faster solution as well. So I was reading up on this, and it is possible through the public distribution system which we have for our rations, right? Which almost 27 to 30 crore people in India avail of. I'm sorry, 27 crore families. The actual PDS system reaches to almost 80 to 90 crore people of India. And just via this system, you can have the center procuring all the masks that they want, and they can distribute these masks through the PDS system. And this is much cheaper, because if you compare the cost of a mask, of an N95 mask, let's say, to that of a vaccine costs about 150 rupees to 200 rupees. I'm talking in terms of manufacturing costs. And a surgical mask at best is 7 to 8 rupees, and an N95 mask somewhere between 20 to 25 rupees at best. So it's much cheaper, it's much faster to manufacture, and it's much easier logistically to actually make everyone mask up everyone through the logistical supply chain. It's much easier, and it will cost India at maximum 5,000 crore for the and I'm saying this because for the vaccines, about 35,000 crores was already earmarked by our finance minister in the latest budget. So if they can do that, they can very easily do 4,000 to 5,000 crores, for masking up everybody. I think that is actually one thing that we are missing out on, and we should be doing that. one alternative to the lockdown. The second point I'll come up to that you raised was being prepared, right? Like this will give us the time for actually preparing and ramping up in terms of our medical kits and our oxygen cylinders and everything. And I've raised this point already, but that will maybe then require a 4 month to 5 month period of lockdown, right? If you actually plan to do it. And I don't know whether it's even still it's still possible even because we had that time, and none of the center or the state governments did not bother to actually scale up in terms of their healthcare infrastructure, knowing that a second wave was most likely coming, given the fact that it has happened in almost every other country. So we had that time. I just think that there is too much of a logistical challenge and too much of a budget challenge for us to attempt at these attempt at really scaling up in terms of our healthcare infrastructure. That's the second point I would say. And then in terms of another point that you raised was state lockdowns, and I'll come to this right now because almost 60 to 70% of India is already in some kind of a lockdown, right? Most states have, enabled partial lockdowns already, in which you have non-essential shops that are selling non-essential commodities already being shut down. And in terms of, the hospitality industry, only takeaways are allowed, right? And public transport has already been stopped, so it's only the trains and flights that are running. Now, do you want, when you have a national lockdown, all of this is going to stop as well. Most of the essential commodity shops are going to even, stop. Flights, trains, most of that is going to stop, and whatever remains in terms of, that is still open right now, all of that is basically going to come to a shutdown for 4 to 8 weeks. Again, like, do you want to do that again? Given, don't you think that just partial lockdowns right now in states, they're enough? Like, let the states decide, according to whatever scenario they're facing, rather than going for a proper national lockdown, which I would again add will only add stress to the economy of India in total, right? And if I talk about the migrant crisis last year, a repeat of that is most likely going to happen again, right? Almost 1 crore migrants from all of your states, from UP and Maharashtra and Delhi, and from almost all of these, metro cities as well. Almost all of them, like a lot of them went back, and they went back like in groups, and almost 1 crore migrants went back to their home states, and it's not easy to reverse that trend. It's not like just when you open the lockdown, everybody's going to come back in. So you're going to have a repeat of that again. And again, you're not prepared for it. I'm pretty sure you're not prepared for it because firstly, you do not even have a register, that lists down the names of these migrants. You don't have them recorded anywhere. Because of that, we don't even have the official numbers of last year, how many actually left, how many actually died. We have no idea. So even organizing anything for, before, let's say, a lockdown, organizing anything for these migrants is anyways a logistical challenge in itself. Do you want like all of this this economy that this impact that it creates? Why go for that? Instead, just follow the alternative, which is masking up, increasing your vaccine infrastructure as much as possible. What do you think?
Vishesh, you raised some very important points. And honestly, as I said from the beginning, I never said lockdown is something that I support as a solution. Like, it's right now a Hail Mary, honestly. If we look at the system, if we look at the infrastructure, if we look at the healthcare, if we look at the people around us, it's just a hands up Hail Mary. Even I thought about the lockdown because, I wanted a bit of stagnation. And since then, I have been thinking of the migrant crisis and I have been thinking about the economy. But so I will take one point at a time. That we are thinking about masking up India. If we give them surgical masks are to be disposed within 1 week at most. You cannot use them after that because it's useless to use them. How many times will the system keep on giving masks and keep on teaching them? Because we have had this drill before. There were videos, there were volunteers spread across rural India and in urban India as well, trying to teach people how to wear the masks. But how many people are actually listening? We can hand people masks. Lots of NGOs have tried that since last year. They have been given free masks. In Kolkata, I have seen a lot of NGOs working through this. In Mumbai, Delhi, lot of places. But people do not listen. That is a very cruel and a very sad point, which is also a reality. Right now, I know that if I walk to my balcony, I know the persons who sell fruits, flowers, none of them will be wearing a mask. The people aren't aware of the crisis to that extent where they know that this mask can help. Even teaching them, I think after a point, like we have tried to teach them since March last year. How far has this taken us? Making people wear masks and appropriately, making sure that they clean it and then they dispose it. There is also this crisis where people use old masks repeatedly, which does not stop the transmission. Lots of N95s, you will have to be very specific, like 30 uses later, they have to be disposed. Surgical masks, 7 uses daily, double masking, dispose it. So there has to be, first of all, a constant resource management for the masks. Somebody needs to keep giving them. And how do we do that? Because even if we put in the volunteers out there, say in rural Bihar, UP, rural West Bengal, the entire belt, these volunteers might also be carrying the transmission, coming back with the viral transmission into the urban areas, and constantly back and forth giving them these masks, making sure that they are ramped up. Who is going to enforce and ensure that they are wearing masks? Niti Aayog has said that, wear the masks at home. Every healthcare professional, whoever I have seen in any kind of interviews, they have constantly repeated, mask up, mask up. It's very important. Nobody is listening. At least on the ground level, nobody is listening. That is what, you go out into the street just for your essential goods shopping, I think you will see the proof right in front of you. And even if you tell people, even if you try to educate them, I think it is going to take a while, because let's face it, India's education system, India's education quotient per se is also very unbalanced. We have a lot of people who are very aware, a lot of self-aware people who are constantly using sanitizers, they're cleaning their homes, they're wearing masks. And then we have people who do not even think about the importance of masks. They do not know the logistics of the masks, who probably can't even constantly afford masks. What do we do in these cases? So that is one huge logistical challenge that I believe comes across with masking up. How fast can we educate India? We have tried since last year. It is very difficult. So that is one. Yeah.
Please, yeah.
Yeah. Next is for vaccinations, what I believe, right now we have a surge, but we also need doctors to vaccinate people. How are we managing? How many doctors does India have? I think that's a real question right now. We have to deploy professionals to vaccinate, but we also have to make sure that people are being tended to in hospitals. And these hospitals, which are being used as vaccination centers, are also doubling up as COVID wards. And there have been plenty of recorded cases where people have gone to vaccinate and they have instead gotten the disease because there has been such a crowd. It is unmanageable. I would even I don't know, how do we streamline this number of people coming in? Right now, I believe that the vaccine gap has been suddenly increased to 12 to 16 weeks, the second dose. I believe it is also in a manner to recuperate with the pressure of the population to vaccinate and also a vaccine shortage as well.
Mhm.
That is also like, because how many vaccines does India really have? How many people can be vaccinated at this point? And how many healthcare professionals can we deploy on both ends? And with diseases coming up every day, there is a new disease mutant, or there is another disease coming up. Like, I think a very important disease that we really need to talk about is mucormycosis. And mucormycosis is a disease that can only be prevented if very intricate personal hygiene is maintained, both in hospitals as well as in homes where COVID patients are. Even before masking up, how can we teach India to maintain proper hygiene, especially in rural areas? How do we ensure that? That is also a thing. But at the same time, mucormycosis has a fatality rate which is way higher than COVID. It's 67%. And immunosuppressed or diabetic patients, they are all, if they end up getting it, it might as well be a lost cause. And this variant, I personally feel, is a lot more fatal than the last one. The variant that we have right now in the second wave, it is killing more people. We have a death rate of 4025 per day. We have, and even if the number of cases drops down from 4 lakh to 3.26, the death tolls are increasing. The crematoriums are chock full. People are not getting bodies, their loved ones, to even burn them properly. So, and if we even think about the migrant crisis last year, that had been a very dark chapter in India's history. And that is true. The kind of posts that we saw, the kind of crisis that we witnessed, and you're right, there are no numbers given. There are no recorded numbers which we can say. But right now, what I keep thinking is that even if we have like an economy, for the sake of the economy, in order to make sure that we have the workforce intact, what if this economy collapses because the workforce gets sick? Do we have the backup of essential healthcare to support them? Now, I'm sure that most of these migrant workers aren't insured. They won't even get beds. Right now, the statistics in a Maharashtra village is like, for 10,000 people, there are 2 hospital beds. That is the state of the rural Indian crisis. So if there is no lockdown, and state lockdowns, I can see like they are not being enforced with that much pressure as they were in last year's central lockdown. Lot of services are being still done because, I haven't seen, at least in Kolkata or in West Bengal, I don't know how it is for you in Karnataka. I can see people who like sell their items in the streets. They are still available in spite of this lockdown. So a state lockdown is not being enforced with that level, and we cannot say like one state, let the states deal with it individually. We are not a federal country. We are not a federal constitution in totality. The central is the responsible parent of all states, so to speak. So, and even then, it would be an unequal management in all states. Say if Kerala imposes a lockdown perfectly, we see a surge of cases lowering there. But what if migrant workers come from, say, West Bengal or UP into Kerala? They are not having their lockdowns imposed correctly, right? So even that enforcement is unequal. And so, and for the rural Indian crisis, like as I said, the number of beds are so low. Bodies are floating up on the Ganges every day. Now that we have border security forces to see that people are not throwing bodies in. So, and if the urban economic, if the urban healthcare infrastructure looks like it's collapsing, I don't even know what the rural healthcare infrastructure really is. Right. So how do we stop that? Because right now, last year we saw that rural India wasn't as much affected by COVID. It was still the silver lining in our economy. Mm-hmm. if there is no lockdown, if there is no solution, if there is no vaccination, and rural India is steadily getting infected by the second wave, how do we even have this economy then? How do we save our economy? And without the grains, without the rice, without the agriculture backing us up, which is still the 60% of our backup, how do we like even survive ourselves?
Great, great. Uh, so I'll start with the masks point that you raised, and there are like a couple of points there. One is that one is that of awareness, and that people not following the rules of masking up. I think that can be solved by just imposing a very strict rules against, like, if you don't mask up, then so and so, right? Just as you're proposing a lockdown, which is that people should not venture out of their homes, right? So that's imposed very strictly, right? Why can't we have the same thing for masks, right? Just a very very strict rule by the center that anybody who is seen without a mask will probably be fined, or will probably, whatever, like, you can impose whatever rule you want, but just a very strict rule again for masking up. I think that will solve the majority of the problem that you're talking about in terms of awareness, or in terms of people not wanting to do it. That's one thing. And then second thing is, I would just like to quote a very important study here, which is done by a person called Mushfiq Mubarak of Yale University. And what they did essentially is, in Bangladesh, they went to, they took a sample of about 350,000 people in about 300 villages, and they just distributed free masks to them. And I think the mentality, the kind of people there, it will be very similar to what India is facing right now. So when you talk in terms of people not wanting to mask up, or people not even being aware of masking up, I mean, what they essentially did was they just distributed masks for free. And when you have so many masks being distributed, people automatically started wearing the masks. And within a period of about, I think, 2.5 to 3 months, these 300 villages, the rate of masking up went up from about 17% to about 63%. So, the mentality shift can happen in both these ways. One is you distribute the masks for free and properly to, like, everyone, and regularly, which comes back to the point that you were mentioning about surgical masks having to be replaced quite often, and N95 masks also having a 30-day kind of replacement, 30 times usage and then replacement period. We can do all of that, like, and I mentioned that before as well. We have a proper public distribution ration system. All the shops that people are already very familiar with. They're familiar with the person who provides them the ration. They just show the ration card and then they get their ration. So they're very very familiar with these people. The whole system is actually there. You just have to use the system for distribution of the masks. So you have that, and you constantly keep on doing it. Like, you just constantly keep on providing masks down the supply chain. And if you're doing it for free, people will automatically start using it. But it doesn't matter whether it's a 1 week period or a 30-day period where the mask has to be replaced. That automatically, that mentality shift will start happening. But you have to, like, obviously the center has to earmark about 10,000 crores, 15,000 crores, something on those lines, to really mask up everybody. Okay, so that is one thing. Then in terms of you raised a lot of points again in terms of healthcare infrastructure not being there, and rural India, especially if this is already spread into rural India. So if we don't have the healthcare infrastructure in urban India, how are we going to deal with it in terms of rural India? And then you spoke about the migrant crisis as well. That none of us wants a repeat of the migrant crisis. But will everybody in India be able to contribute to the economy if they get infected, right? And then another thing we talked about was in terms of state lockdowns not being that stringent, and and I totally agree with that. That most states have not imposed it that stringently, and that's exactly my point. That if you have to continue the economy of India and you don't have to put a shutdown on everything, you need these lockdowns to be not that stringent as well, which is I think what most states are adopting. So overall, I totally agree with all of your point of views, but to me, it just seems like having a national lockdown will not give any permanent solutions to any of these things, whether it's healthcare infrastructure or migrant crisis, or even people not being infected. I'm not sure whether this is anyways a permanent solution once we reopen. If we're going to face the almost the same problems anyways. For me, I think the most important solutions are to find something permanent, and that would be that let the economy run, let the economy continue, and meanwhile, mask up as much as possible, uh, uh, ramp up your vaccines as much as you can, and then all of the healthcare infrastructure etc that we're talking about, that can be done simultaneously. Like yes, there is a lot of pressure on doctors, and yes, we don't have that kind of healthcare infrastructure, but we can simultaneously, if the government really puts their mind to it, they have to do it simultaneously along with the economy. Stopping the economy overall is going to really really affect India, and is going to in order to save the infection spreading to 140 crore people, and we are at a pretty low number if you think of it that way. Like it's still in the ballpark of around 3 crore or 3.5 crore people in India overall infected, right? So you're really going to affect the lives of almost 140 crore people in India with a national lockdown. And for my last point, like in spite of having said all of this, I will just also put an additional point that I think the stock markets of India support a partial lockdown as opposed to a national lockdown, and I'll give my reasoning for it. Last March, when the lockdown happened, the stock markets dropped by almost 30%. Sensex, Nifty, all of these, they dropped by almost 30%. Whereas right now, in the second wave, in the start of April, we have not seen a drop of more than 6 to 7% in terms of the stock markets. Uh, so everybody is basically not considering a full national lockdown. But if you were to today announce a national lockdown, I'm more than sure that the stock markets would really drop. So I mean, I'm not saying that stock market is really is the holy grail of everything, but it is an indicator of your overall economy and what the overall sentiment in the economy is. And the stock market also kind of, I think, very easily kind of factors in this thing that a national lockdown would be really disadvantageous to a large chunk of the population, which is why last year it dropped a lot, and this year, because nobody's expecting a national lockdown, to be honest. So this year it hasn't dropped that. So that is my overall conclusion, my overall, I think, point of views. If definitely, if you have anything to add here, you can definitely add.
I think, Vishesh, we will stay in like two different roads in this one, like about the lockdown. In the middle ground, I could even think like, if center mobilizes some forces in all the states to ensure that these state lockdowns are imposed correctly, at least. There should be RAF or the army. And the most problematic part of making sure that people are fined or punished for not wearing masks. Like, how many police personnel or army personnel are you going to deploy in residential areas where people actually don't wear masks? The communities in residences. Like, I live in a certain community. Will there be a traffic sergeant imposing fines on people to not wear lockdown? and just put this similar thing into a rural setup. Who is going to ensure? How many police personnel or like people, like, administrative professionals do we have to ensure that they go about asking? A change in mentality is a huge hope, and I do hope that your hope really comes true. For me, I am a bit skeptic because I have been seeing from March that it is very difficult. It is very difficult to change certain mindsets. But here is like hoping that adaptability, awareness, all of this really comes. And your idea of distributing masks through the PDS is a very good idea. Making sure that the logistics of it is in reality worked without fail, I think that is also a very difficult part. We have seen how administration in all fronts, be it state, panchayat, rural, urban, it's collapsing. Even minute things before COVID, like making sure water is present in every council ward, was difficult. And even going through the ward councillor to making sure that you get your rations rice, those had hurdles. I don't know how hard it would be to make sure that masks are realistically available to all. I think a big part of it will be played if, private organizations and NGOs took in the effort. They grew even more proactive. And even as responsible citizens, we distribute the masks ourselves. But all of these are based on a lot of ifs at this point. Like, if this happens, then this will happen. If this happens, then this. And most importantly, the biggest if is, India's psyche changes. And that is a very big if. And here is hoping that that comes true. I really hope that your side of the argument really comes true.
Great. I mean, I hope as well. And I think all we can do right now is hope. Hope is a big thing. Hope is what keeps driving us. Yeah. So I think it was a great session. I think it was great discussing this with you, Sugandha. And I think we've given a lot of information. Plus, we've put forward a lot of points worth considering for our audience. Everybody who is watching this, please let us know in comments what you guys think. And if you really like our sessions, please do like, and please let us know if we're on the right track, and we'll continue bringing these sessions to you. Thanks a lot, Sugandha, for doing this with me.
Thank you, Vishesh, and thanks everyone for watching us. Stay safe and stay at home. Please take care.
Yes. Stay safe and please take care, everyone. Thank you so much.